I could.
Okay.
Thank you, Mr. Chairman. Actually, the experts are the people in front of us, folks who have served and will serve for long periods of time in the field, and many who are with you. I appreciate the compliment, but I am undeserving. I'm confident of that. Having just returned alongside Senator Van Hollen in a bipartisan group from a visit to a number of countries, I think this has already been brought up. I just want to start by expressing my deep gratitude to each of you, to your families, for your willingness to continue to serve our country in a number of contexts that are very challenging. So let me get to it and try to be brief if I can. Dr. Murthy, it's great to see you again. I know it is somewhat unprecedented for there to be a requirement for a separate hearing for WHO representation, but you've just heard some of the reasons why there are heightened concerns. I greatly appreciated your coming to Delaware and to visit some of our young people, our healthcare professionals, and to talk about how we move forward here domestically. Your previous experience in this role and in other roles in the U.S. Public Health Service Commission Corps, I think makes you abundantly qualified for this position. I hope you are promptly confirmed. If you would like to just take one more minute and talk about how you would promote U.S. interests at the WHO, if confirmed, I would appreciate that.
Well, thank you so much, Senator Coons, and thank you again for the invitation to come to Delaware. And I really enjoyed and learned a lot from my visit there. In my view, Senator, as you know well, our health and well-being in the United States does depend on what happens elsewhere in the world. We saw that with COVID. We've seen that with other infectious disease threats. My privilege as Surgeon General has been to look out for the health and well-being of Americans. And that, to me, involves, in some ways, a natural extension into this role, if I'm privileged to have the opportunity to serve in it, which is to work on the global stage to also safeguard the health and well-being of Americans. How we do that means that we've got to ensure that we have better collaboration, coordination, and transparency with other governments. And that includes in the areas of data surveillance and data sharing. It means we need early detection systems, but we also need rapid response operations. Again, a place where the WHO needs to have an effective role. But it also means that when it comes to the production of countermeasures, Senator, we know, again, that all of us are better off when the entire world is better off and when the entire world has access to countermeasures like vaccines and therapeutics. And so part of the work, I believe, that we need to push and engage the WHO on is the work of ensuring that we have adequate production and distribution capacity when it comes to manufacturing and distributing these countermeasures. To me, these are all parts of what we need to do to ensure we are prepared for the next pandemic. But finally, I'll say this, Senator, we need an effective WHO, not just for pandemic preparedness, but for many of the other health threats that we are facing. And for the WHO to be effective there, it has to be credible, which means it needs to be able to deliver on promises. It needs to be transparent in decision-making, and its workforce also has to adhere to the highest ethical standards. And those are the issues, again, that I hope to focus on if I have the opportunity to serve.
Terrific. Thank you very much. Part of our trip was celebrating the accomplishments of 20 years of PEPFAR, launched by President Bush, the single largest public health intervention in world history, which has saved more than 25 million lives. Its path forward will, in no small part, come through this committee. And we got to see, for example, in the country of Zambia, how significant investment by the United States has saved huge numbers of lives. In South Africa, the same. So I hope to work with you both on pandemic prevention, but also in celebrating some of the ways in which our investments in public health infrastructure on the continent of Africa and elsewhere in the developing world have made us safer and have helped avoid preventable deaths. If I could, two more questions. Ms. Fitzgibbon, just interested in what you think of the stability of the Bazoum government. Our time in Niger was disconcerting. And they are, I would say, an island of stability in a region beset by chaos. I'm very concerned about Russia's presence and the way in which Wagner has taken a more and more aggressive posture to the east and west of Niger. I'd be interested in how you think we could successfully counter Russian disinformation, which has had an impact in all of the countries to which you're nominated to serve, and how we might more successfully engage the people of Niger and the Sahel region in a way that would promote stability.
Thank you for that question. We have answered the government's request for help on disinformation, whether it's Russian disinformation or Chinese disinformation. Our senior bureau official for public affairs went out to Niger in November. We've brought down experts to help strengthen the journalistic infrastructure, so to say, so that to help the journalists understand better how journalistic integrity is very important to putting word out to whatever information they're putting out. And then we have helped point out to them when we see disinformation. And to all that end, China has put on a big PR blitz in Niger, but its actual popularity ratings are going down despite how much money it's putting into there. So something is working there. Part of it, I'd like to say, is our U.S. Embassy's public affairs program and reaching out to people, our people-to relations are working. And with Wagner, we have a strong ally in President Bazoum on Wagner. The smallest of our Ds, as we were talking about a little bit earlier, is our democracy funding. But one of the things we can make up for that with is diplomatic engagement. And I intend to work very hard, and I've done this in every country I've served in, with the political elite to make them understand that there are a lot of political trade-offs that need to be made for the long-term stability of the country. And the economic and social investments that need to be made in Niger need to be made now. And
Agreed.
that means the opposition and members of the ruling party and aspirants to be the next president of Niger need to have that buy-in, because if the country's stability is at risk, and the time is now. The attention from the United States and the attention from other donors is now too. So this is the time that the country can benefit most. And I believe that President Bazoum has that commitment, and we will make sure that we're talking frankly to him when we see things that might be done better. So I'm hoping to have a good relationship there.
I look forward to hearing from you. Could I beg the indulgence of one more question, Mr. Chairman? He's distracted. So if I could, Ambassador Mills, I am interested in each of your countries. I apologize, but I'm already out of time. You will represent us in Abuja in one of the most populous countries in the world, a real linchpin for West Africa and its stability, and where the outcome of the election, I think is leading to some widespread disappointment amongst those who'd hoped for change, and the possibility for real continuity. What do you expect out of the Tinubu government? What do you think his previous service as governor of Lagos State, if I'm not mistaken, is going to lead to? And how do we build a more stable, sustainable relationship between the United States and Nigeria, given some of our issues in terms of the conduct of the Nigerian armed forces, internal division, and the very strong and robust diaspora community here in the United States? Good question. Sorry.
And in a way, that's the answer. It's a holistic approach. It's if we're going to deepen the relationship, which is actually quite strong. We have quite an engaged relationship with Nigeria across the board, economically, diplomatically, culturally. We have to use all the tools, as I mentioned in my statement. In terms of the election, I would point out that there was some good news from the election. Candidates, the top three candidates each won over 12 states in the election, which is new. And I think that reflects the diversity of the political system there and a lot of new voices taking part in this election. That's very encouraging. I think if President-elect Tinubu is listening, he knows that there was a great demand for change. The campaign that in many ways supported the candidacy of Peter Obi, a lot of young people came out, and I think he will be aware of that. We certainly will remind him of the need to be responsive to that moving forward. In terms of our priorities, we've for a long time, our work in Nigeria, guided by the administration's Africa policy, African strategy, and the mission's own strategy, has focused on really 4 key areas that we're engaged on. Improving security. Nigeria is a counterterrorism partner. We have to improve their ability to fight the terrorism threat that they are facing. Working to develop the economy through mutually beneficial trade. Human rights, huge issue that we need to promote and we need to increase accountability. And the transnational issues that the doctor mentioned. Nigeria is a partner in transnational health issues and crime issues. So those are our priorities, I think. You mentioned security in particular. And to get to Senator Rish's question about the Sahel, I think in some ways there is a success story in Nigeria. The last couple of years, as Kathleen knows well, we have sold to the Nigerians at their request some important military precision munitions and aircraft. Those aircraft in the last 2 years have made a difference in their ability to fight the terrorism threat, especially in the Northeast. It's reduced those precision munitions, civilian casualties. And I think more importantly, and this is the secret, we sold these weapons, and nested inside this sale were important human rights components, important new steps. We said, if we're going to share these weapons, sell these weapons to you, you need to take these actions. Everything from new air-to-ground integration teams that have really reduced civilian casualties wherever the Air Force is working in Nigeria. But we've put in a military justice advisor. We've put in a new advisor into how to work with the civilian communities. And I think that's a real model for moving forward. And that'll be a priority moving forward, to continue monitoring that and building on that.
Thank you. It's a complex issue. I appreciate your answer. I've been to Borno State. I've been to Nigeria several times. I look forward to staying in touch with you, and I apologize for running over. Please, Mr. Needler, Ms. Tremont, give my regards to President Kagame and President Mnangagwa, and thank you to all of you and your families for your willingness to serve.